Okay, so we've come in, scene is safe, we're wearing the correct PPE, which is gloves and glasses. The Apgar needs to be performed at 1 minute after birth and then at 5-minute intervals. So the Apgar has a point system, so depending on the score will determine our treatment. So we're checking the appearance, so just to make sure that the baby is nice and pink all over. If the baby is cyanosed or pale, then the baby will get a 0. We're also looking for any cyanosed extremities, but the torso is pink, so that will get a number 1. And then the body all pink is number 2. We're then checking the pulse rate. So absent, if it's absent, it gets a 0.0. If it's under 100 beats per minute, it gets a 0.1. So generally, checking the heart pulse rate, you normally tap it out so people can hear, just on a hard surface, just so that your colleagues can hear it as well. So under 100 beats per minute is 1, and then over 100 beats per minute is 2. Then we're checking for grimace. So if the baby has none, is sort of lifeless, it gets a 0. If they have a weak grimace when stimulated, it's a 1. Or if they have a cough, sneeze, crying, that sort of thing, it's a number 2. So this baby would be a number 2. Activity, so none is 0. Some flexion of the arm, which you can see there, is 1. And then obviously arms flex and then legs resist extension is a number 2. So if they're quite active. Respiration, so none is 0. Slow, irregular is the number 1. So you can just place your hand on the chest there and just make sure that they're, and then if they're fast and regular, and the baby has a strong cry, then it would be classed as number 2. So a point score of 0 to 3 is critically low, so then we would provide resuscitation. 4 to 6 is fairly low, so that's normally your rescue or aeration breaths. And 7 to 10 is generally normal, so we just do your normal treatment of drying, warming, positioning, suctioning if need to, if there's any obstruction there, and tactile stimulation, so just sort of firm drying of the baby.